with her camera, so she's going to leave and rejoin. Oh, there she's back. And so thank you all for joining today. This is our monthly careers close-up where we shine a light on a different career within the healthcare sphere and allow you guys to learn a bit more about what it is like to work within that area of healthcare and ask all your questions. This is definitely a safe space, so please do interrupt and ask questions. And we also have a link streaming live on YouTube, so some people join from there. Feel free to send the link around to people. Today, I'm super excited and we're very privileged to have Tayla with us, who's a very experienced registered nurse working within aesthetics. I'm just going to read her bio. So Tayla is a registered nurse who has worked in the health medical field for more than 10 years. She is trained as a beauty therapist, qualifying in 2015, then began her career working as an aesthetic therapist in a medical clinic, offering skin treatments, laser hair removal, and assisting with doctors. Sorry. And assisting with doctors. Where was I? So let me start again. Tayla is a registered nurse who has worked in the health medical field for more than 10 years. She trained as a beauty therapist, qualified in 2015, then began her career working as an aesthetic therapist in a medical clinic, offering skin treatments, laser hair removal, and assisting doctors with injectables and cosmetic surgery. She then worked across different healthcare settings within the NHS from 2017, predominantly in intensive care and the community, but also experienced surgical wards, gastroenterology, cardiology, and plastics. Training as an apprentice while working for the NHS, Tayla initially qualified as a registered nursing associate in February 2021. Once she graduated as a registered adult nurse in 2023 with a bachelor's degree in science, she worked in dermatology, specializing in skin cancer surgery and wound care. Tayla now works in her own clinic, offering a variety of skin and aesthetic treatments that she is trained in, and has recently left the NHS to fulfill this role full-time since growing her practice from 2021. So as you can see, that is a very loaded CV, and I think we've all got lots to learn from Tayla today. So I'm going to hand over, and please do ask your make sure you take a lot from this session.
Thank you. My very descriptive job description there. As Emma explained, I have got a lot of experience behind my belt, both in healthcare and in aesthetics. So I will go into a bit of a deeper dive about my journey into aesthetics and hopefully shed some light about how you might transition as a medical professional into aesthetics as well. So in my career, I always wanted to go into aesthetics and I always wanted it to do it the medical way. So I don't know if many of you are aware, but in the UK, there are not many regulations around who can practice in aesthetics. So there is a bit of a grey area about who can do what, but it was very important for me to not only be a medical professional for my own ethical standards, but also for my clients to feel that they're safe when having these treatments, because in my opinion, it should be done by a medical professional. And what I did is went straight into beauty therapy when I left school. So I really wanted to get hands-on working alongside people in the beauty industry. So a lot of the treatments that I was initially trained to do included things like facials, waxing and sort of eyebrow and eyelash treatments. So it gave me the experience in working face to face with clients who would come in asking for certain treatments. And it really gave me the foundations and sort of that knowing that I was doing the right thing. So at the time, you could use any level 3 qualification to then go and get a nursing degree, which soon changed midway through my level 3 course. So I decided once I qualified to go and just work in an aesthetic clinic. So I would work, as Emma mentioned, alongside doctors doing different surgical procedures. So this would be things like mole removal, all private work. So we'd remove moles, we'd do vein removal, we'd do blepharoplasties, we do liposuction. So I would assist the doctors, but also do the treatments that I was trained in, which in this clinic were a bit more advanced than the facials I initially trained in my beauty course. So these included things like microdermabrasion, laser hair removal, chemical peels. So it was really what I needed to get that exposure. And as I knew I couldn't do my nursing just yet because they changed the rule about the level 3 qualification accessing the degree, it just gave me the foundation in aesthetics, which I was quite eager to get. But I always say to people, it's not essential that you take that jump and go and work straight in aesthetics. And actually, I think for a lot of people these days, coming from a medical background, a lot of your skills are actually transferable into aesthetics, which I'm going to go into a bit later about how you might transition into going into aesthetics if you don't have this prior experience. So once I had this foundation, I was then aware of a new apprenticeship scheme that the NHS were offering, and this is how I became a nurse. So alongside my beauty training, I also worked in the community as a carer. I worked in nursing homes. I was basically on the 0-hour contracts and had experience in working in care. So I kind of was ready to combine the two fields together. So working in the NHS, originally in intensive care, I basically worked as a healthcare assistant whilst also studying my level 3 course in health and social care. And this was the new requirement that the universities wanted before you went into nursing. So I did that alongside working, which meant that I also had experience in working in the NHS. So having a medical background will really help you in aesthetics because it's transferable skills. You're working under pressure. You're often having to make decisions very quickly, especially in aesthetics. If you do choose to go and work on your own, these are skills that you're going to want to have, and you probably already do have from working within the NHS, or if you're working in private healthcare sectors as well. So having that foundation allowed me then to go on to my apprenticeship, which the one that was offered at my hospital was a 2-year foundation course. And this is where you do your nursing associate. So a role that's very similar to a nurse and is regulated by the Nursing and Midwifery Council. So I was trained to do, to look after patients, in a surgical ward, in any sort of location in the hospitals. You could take a bay of patients, you could administer medication, but it couldn't be IVs. And that's where the big difference was with a nursing associate and a registered nurse. So although I was allowed to give medication in the hospitals and I was allowed to look after patients, be fully independent, writing my notes, liaising with the doctors and all the medical staff, I was still restricted in aesthetics. So what this meant is that a lot of the training courses from really reputable providers would only train medical professionals, which included a doctor, a dentist, a nurse, or a midwife, and some pharmacists. So it meant that I still, although I was doing injectables, intramuscularly, subcutaneously, I wasn't allowed to do them in aesthetics by these training providers. So I still knew I needed to continue my nurse training. Some other universities and some trusts partnership together, and what they offer is a 4-year nurse degree apprenticeship. So my trust just did it a bit differently by doing the nursing associate course first, but there are some trusts that will do a straight 4-year nurse degree apprenticeship. So this is also an option. It's an extra year longer than the traditional nursing degree route. So of course, I could have gone to university for 3 years instead, but I had already gotten used to working a job. So for me, it wasn't really an option, but the option is also there. And what I then did is topped up my nursing associate course with the nursing degree. So that was a further 18 months as an apprentice. But when I qualified as a nursing associate, it was COVID. So I was a little bit delayed in getting my qualification there, but we got there in the end. So hence my very long, extensive CV, as Emma mentioned earlier. It did take me a very long time to become a nurse, but during this time, I gained so much experience in working in the medical sector that it really helped develop my skills and my confidence when I then went into aesthetics as the injector myself. So during the last sort of couple of years in my training, I partnered with a lady who already had her own aesthetic clinic. So this is an option for you if you're thinking, how can I get into aesthetics? You don't necessarily want to leave your NHS job. You want the security of still working in healthcare while you grow that. Then this is a really good option because she was an aesthetic therapist and she already had her own laser hair removal clinic. So I was already trained on the laser hair removal machine she had. So she allowed me to come in and start taking over some of her clients. And this gave me the step back into aesthetics, which was greatly needed, I think, after COVID, having worked in ICU and just trying to get myself up and running before I fully qualified as a nurse. And what I then went on to do was treat some of her patients, but also bring in my own patients to treat with the laser. Once I had built up enough clients through that, it was still very quiet. And obviously, I was still studying, I was still working. So life was quite busy. But once I had that sort of already established, I then decided it's time to start my own aesthetics clinic, and still wasn't qualified as a registered nurse. So I very much stayed within my remit and I just did the treatments I was trained in. So this included things like facials, I did chemical skin peels and just general skin consultations, getting people started on products, as well as doing the laser hair removal still. So this was something that, again, it took quite a while to just build up, because I feel like a lot of the clients I have now are all from word of mouth recommendations. And of course, Instagram is great, Facebook is great, having a website is great, but it takes time to build a business, and especially something quite particular when we're talking about people's faces. It takes a lot of trust to build in people, and I would definitely say that since becoming a registered nurse, that people have been coming more to me because of the fact that I'm a medical professional, and that definitely builds trust. So although it's quite a saturated field, you'd be surprised at actually how many clients there are out there, and I wouldn't be put off because a lot of people are doing it, because there is somebody out there for everyone, and you could be that person that somebody trusts in because of your background, because of your passion, because of your specialist area, that they then want to come to you. So this is definitely what has helped me thrive in my business, and more so when I qualified as a registered nurse, I specialised in dermatology. So coming from a beauty background, I was already very interested with the skin, and this is my specialist area. So although I still do aesthetic injectables such as Botox, fillers, I also do a lot of skin treatments, so skin boosters, mesotherapy, polynucleotides. I still do facials, I still do chemical peels, because I believe that there's a massive holistic approach in treating people with their skin concerns. And this is why people come to me, because they know that I'm all about the skin. And I think this is something that, particularly in my area, stands out, because a lot of people, especially people that are not medically trained, they specialise particularly maybe in injectables or filler. And this is something that anyone can do in the UK, which kind of takes away, I think, from what my patients tell me, is the trust. So I think it's really good to have that medical background. And as I mentioned, you already probably have these skills from doing injectables, from doing patient assessments, that you are practicing these already, and you can transfer them into aesthetics. So it took probably about a year after qualifying as a registered nurse for my practice to be consistently very busy. So in total, probably 3 years for it to get really up and running. Instagram has definitely helped. What I did as I qualified as a nurse, it enabled me to then go on and do the training courses that I mentioned earlier wouldn't accept me as a nursing associate. So I trained with Harley Academy, doing the foundation course in botulinum toxin filler, and this really set me off in my practice. It was still a one-day course, which I think coming out of any one-day course, you never feel fully confident to go out and then start performing these procedures. But I was lucky enough, the lady that I worked with in the laser clinic, she knew a nurse prescriber who had been doing aesthetics for 20 years. So she was very happy to mentor me in my own practice. So there are courses available where you can have mentorship available, or you could go down the route of a level 7 qualification. And this is going to give you the experience and the confidence and all the tools and the networking that you need to thrive in the industry. So it doesn't need to be a lonely game if you're thinking, how can I become self-employed in this? It can very much be, there is quite a lot of resources out there for you to still not feel like you're working alone. So alongside this foundation course, building those treatments up, attending other training courses, more advanced botulinum toxin courses. I've done lots of mesotherapy. There are skin treatments out there. I did a microneedling course, and these things are just things that you can add on depending on what you're most interested in. You might just choose to specialize specifically in one area. You might just think, I'm going to absolutely master lip filler, and that is your thing, and this is what people will know you for, the same way that people come to me specifically for their skin. So I think that the world really is your oyster when it comes to aesthetics. It's just navigating how to get there. So that is my journey and how I got into aesthetics and building my own practice. So I will explain a little bit about how you could transition into aesthetics too. So as I mentioned, you're already doing all the things that you would do in aesthetic practice, and this is predominantly why I think it should be a profession that is specialised by medical professionals, because we are doing patient assessment every day, whether it's in the hospital or if it's in aesthetics. We are creating a treatment plan, giving our patients options, whether it's in the hospital or if it's in our clinic. We are responsible for that person. We weigh up the benefits and the risks. We do the consent. We carry out these clinical procedures and these skills, and we give the aftercare and we do the follow-up. So this is literally the same thing you will do in an aesthetics clinic, where whatever treatment that you're offering, it's always the same sort of standard. So as a medical professional, you'll be transferring these skills directly into your clinic as well. And as I mentioned, the training courses that are available to us are definitely more limited in the UK because we're not regulated. There are many different training providers which may not have necessarily medical backing. They may not be insurable by the really good insurers that are predominantly just supporting medical professionals. So investing in your training course and doing your research into those is definitely something to look into and take your time with. As I mentioned, Harley Academy is a really good training provider and is well renowned for the level 7 course. Cosmetic courses is another one that is also really good and has also got a level 7 qualification. And currently in the UK, we are working on getting our regulations in place so that we have a bit of a better structure that's standardized across the country. So hopefully this comes into place within the next couple of years, but it's still something that we're working on. What this does also mean is the lack of regulation with where you can practice from. So you are on your training courses, you've done your training in a few aesthetic treatments. Where do you work from? So you've got the option of working in a clinic. As a medical professional, you'll probably find it is easier to get a job in aesthetics without necessarily having experience in aesthetics. You might even get away with a clinic supporting your training and funding that for you if they're willing to invest in the right person. Like I said, when I first started working in a clinic, they gave me all in-house training based on the fact that I had my beauty qualification. So that's definitely an option out there. Or you might find that you do some training that you fund yourself, and then you go into an aesthetic clinic and work there to gain the experience, and also work alongside other people, because I think that's still key. It's like whenever we do our degrees, we're always working alongside other people, we're getting signed off on these skills, and it's exactly the same thing. So if you decide to go into employment in there, you obviously have the option to still keep your foot in the door with the NHS too. Or you might find that you just decide you want to go self-employed. And this is where I think it can be a very lonely world. So the importance of having a right network or a mentor is really important in this. So going self-employed, you need to think about where you're going to be practicing from. So you could practice, honestly, you could practice from anywhere because there's no regulation in the UK. But of course, as medical professionals, we hold our own standards of what is safe and what is unsafe. So if you were working from a room in your house, if you were working from a salon or renting a room somewhere, you have to make sure that you're keeping standards high in terms of health and safety, hygiene, and just making sure that it is actually appropriate for the procedures that you're carrying out. It doesn't necessarily need to be a CQC regulated practice. It just depends on what treatments you are offering. And at the moment, I believe it's only if we're treating a specific medical condition that we have to have this CQC regulation in place. But if we're actively diagnosing something and then we want to treat it, that is when we need to be CQC regulated. So again, this might be something that changes in the future as we get more regulations in place. But for now, you don't need to have that in place. So it's not too difficult if you can find a premises to work from to then be able to offer your treatments from, for yourself. And also you need to think about what treatments you want to provide, where to access all your products from. And I think one of the best places to start is obviously finding somebody else that's in the industry and asking them. You'll find that people are pretty friendly, but attending conferences, and when you go on these conferences, they literally have everybody there in one place that is basically trying to lure you into either joining their training courses, buying their products, trying out their treatments. So it's quite overwhelming, but you get a lot of information in one place. And these conferences are run all throughout the year, which is really handy. And then you get to meet other people there. They'll tell you about their practice. People are pretty friendly and open to sharing, which is really nice. And I think it's really helpful and what we need more of in the industry. So don't feel like you can't approach these people, because even networking through Instagram works very well too. I also would encourage to network on these training courses that you go on. So if you go on these training courses, you'll meet like practitioners, people that have loads of experience, people that have literally just started out, and these are the people that are going to help to support you when you start practicing as well. And a lot of these training providers also offer support after your training. So it's not just like you've done a one-day course, that's it. They give you continued support. So if you needed case studies, if you needed access to clinical papers, if you had needed any advice about a specific person that you were treating, then they have that option available too. And they also have apps and Facebook groups where you can connect with other people and also seek support. So you're never fully on your own. And I think that is the biggest fear going self-employed in aesthetics, but actually it is something that is readily available to you. And how to get clients. I think that is the biggest thing that I definitely underestimated. I thought, let me start my Instagram account, I'll get loads of clients in, and that did not happen. As I mentioned, a lot of my practice is based on word of mouth recommendations. So the more people you see, the more they recommend, the more people that are going to come and see you. And this, honestly, it just takes time. But once you've got that pool of clients, they do tend to stay very loyal to you. It's a very personable experience in aesthetics, and a bit like how you're loyal to your hairdresser or your barber. It's very personal, and this is what I think means that the industry, there's enough clients out there for everyone, because we will all go to who we're drawn to, and there is somebody that might like a certain look or a certain treatment or vibe with a certain person, and that is where your sort of USP comes in, plus the fact that you're a medical professional, plus the fact that you're specialised in skin or lip filler or whatever it may be. So getting clients is definitely a word of mouth. You have to be confident enough to tell people what you're doing, and this will also bring curiosity in, and you'll get clients that way too. But I also think, things like, so very basic, like even just having a website presence will bring you clients in. Being on Facebook, you don't necessarily need to offer up discounts or module offers all the time. Like, people will come to you because you are a legit practitioner doing treatments. And I think this is really important, just to understand that it can be a slow game at the beginning, but as your clientele builds over years, you will become busier. So I think that we're lucky enough to have the backup of our job as medical professionals, because we could reduce our hours in the NHS, we can transition into it quite easily rather than just take the full plunge and just go for it, because it does take time. And as I mentioned, you might just find yourself working in a clinic for a bit of experience first, or you might actually decide self-employed isn't for you and you'd rather just go and work in a clinic full time, take the stress out of doing all the other jobs, all the admin stuff that comes with being self-employed in aesthetics as well, and just gives you a bit more security because you're working within a team there as well. So I hope this has explained a little bit about how you could go into aesthetics. I'd be more than happy to answer some questions. I appreciate you're all from different backgrounds as well. So depending on your experience and sort of what you want to get out of aesthetics is all going to be very different. But I hope that I can answer some of your questions.
Wow, that was really insightful, very detailed, very clear. Thank you so much. Tayla, your camera's frozen. So if you don't mind just leaving and rejoining before we start it didn't matter too much. Oh, I think she's gone, but yeah, hopefully you guys were able to follow. Obviously, we had the slides. Yep, you're back. So it didn't matter too much while she was speaking because we have the slides on show. So, but yeah, ideally, if we can get you for the Q&A, that would be great. Please submit some questions. I've also got the YouTube open. I think it would also be nice just to know who we have listening. So if you guys are happy to either just quickly unmute and say like if you're a nurse, you're a doctor, or you're someone that's thinking about starting aesthetics, new to healthcare, and then yeah, of course, ask away your questions. I think I wanted to ask, how do you actually get a mentor? Because I think it can be quite intimidating, and everyone is so busy. How do you convince someone to actually mentor you?
So with the training courses, they will often have mentors available there for you. So the one particularly with Harley Academy, who I trained with, they have a phone app called Comma, and you can literally go on there. It's a bit like Facebook, but for aesthetic medical professionals. And when you go on there, you can literally ask if there are mentors in your area, and people are actually quite open to it. So I wouldn't be too worried about people not having time for you, because they definitely do. And I think as medical professionals, we all quite like to share our skills and our knowledge, don't we? So it's just like being in the hospital.
That's really reassuring. Would you recommend the Harley Clinic one over? Obviously, like there's no sponsors here, no sponsors.
No.
Yeah, over because I know there's so many out there. How did you end up choosing that one?
Yeah, it really narrowed it down. They were the first training providers that had the level 7 available. So they definitely stood out to me in that respect. I did also look at cosmetic courses and Skin Viva. Just the top 3 that really stood out to me in terms of what they were offering in terms of further education rather than just a one-day foundation course. But I have also trained with Skin Viva for my advanced training, and they also have like a closed-off Facebook group for everybody that trains with them, and that's also another place where you can find mentors. So those would probably be my top 3.
Super helpful. I'm really surprised that no one has any questions, because you've all taken time out to join this on your Tuesday evening. I guess Tayla was amazing, so maybe she's already answered all of them. So I will hang around for a couple more minutes. Otherwise, we will end and allow you all to carry on and enjoy your Tuesday. But this was really insightful. And again, it would be really nice to know who we've got watching. If you guys can unmute or just put it in the chat. Okay, someone is typing. What was the last straw for you to decide to go full time and to leave your NHS post?
Honestly, I requested part-time hours in my dermatology job. I was working 5 days a week in dermatology. I was spending my evenings and weekends in my clinic, so I rarely had a day off. And when I requested to go down from 5 days to 3, they flat out just said no. So I left.
We know, everyone knows how hard it is to work in the NHS, and it's to everyone's benefit to have extra interest and to be able to have work-life balance. But when you try and get it, you just don't, you're met with things like that. It's such a shame.
Yeah, but definitely worked out for the best, I must admit.
Yeah, great. Awesome. Okay. Thank you, Brenda. Hi, Brenda. So we've got Brenda on. She's an A&P in primary care and looking to transition into aesthetics. Thank you for joining. We also have a question from Faye. She says, what would be your recommendation for people who haven't undergone the prescriber's course?
Go for it. I'm not a prescriber yet. It's really important to have a prescriber with you in your practice. And again, this is something that when you go on your training courses, they can also plug you in with a prescriber as well. But you are only restricted really with prescription medication, which is your Botox. So it just means that you have to have someone prescribe it before you can administer it, but you'll want somebody there handy for emergency drugs and for antibiotics should you need them. But many of us in this practice are not prescribers. It would definitely be something to go for to make your practice a bit easier, but not necessary.
On site with you wherever you're doing your procedures?
Only for the consultation, for the initial consultation to prescribe the Botox. The prescription then lasts 6 months, so your patient could have 2 treatments during that time before they need to see their prescriber again.
Okay. And then as someone who's doing it, self-employed, starting their own clinic, like, was it quite easy to get someone to agree to come on as a prescriber?
Yeah, there are a lot of prescribers out there that are willing to do this, even sometimes as their sort of full-time job, just to go in and support other people.
Someone said, hi, Claire. Claire's an aesthetic nurse. She's finishing her prescribing course. Awesome.
Well done.
Yeah. Someone said, do you need another prescribing certificate to be able to prescribe?
So it's as a nurse, it's the V300. So it's about a 5 or 6 month course that you do to become a prescriber, if that's what you mean.
I'm sure Tayla will be happy to answer. Faye said, thank you. She makes herself fund herself if she's able. Did someone unmute? Feel free.
Mm-hmm.
Yeah, we can hear you.
We can hear you. Mm-hmm. No, that's it. Um, that's all you need. I think the recommendation is just that you're practicing, you're prescribing within the field that you're working in. So I would still probably get somebody that's working in aesthetics that is prescribing just to help support you as you start, because it's just like if you went to a new department in the hospital, it's just getting used to what medications are commonly prescribed. You're welcome.
That's really good advice. We had a comment. Hi, I'm Sumter. Hello, Sumter. Thank you for the talk. That was really interesting. I'm a fourth year medical student, so very early in my career. Do you recommend that doctors do this training during their F1, F2 years or post F2 when they have more clinical experience?
Entirely up to you. I'd say if you started getting experience early, then it just prepares you and sets you up for your clinic a bit sooner. Feel confident in what you're doing. I know it can be quite intense, those F1 and F2 years. So just making sure that time allows you to be able to focus on doing that. But yeah, why not?
Yeah, I would agree. Do it when you feel like you're ready and you have the time. If there are any questions on YouTube, not at the moment. Right, okay. We've still got Taylor for a few minutes, guys, so please do send in your questions. Such an amazing opportunity to have her. I have a question. How do you deal with oh, I think you've frozen again, so maybe you want to quickly leave and come back. That's okay. Back now. I was going to ask, how do you deal with people that have really unrealistic expectations about what you can achieve with aesthetics, or people who sort of, are asking for treatments you don't agree with? Mm, that's good. That's really important, I think. Yeah. Being empowered to know that you're the professional, and you only work within what you think is best. So that's really, yeah, that's really reassuring to hear. I've got another question here from Faye. Any recommendations on types of clinics to work in without aesthetic experience while starting as a nurse? I've seen med spas, for example, or clinics such as therapy, but not sure if they would accept me. Awesome. Okay, I think if that's all the questions, I'm going to wrap up. Taylor, thank you so, so much. That was really informative, really detailed. Thank you for answering all the questions as well. Am I right in saying that people can contact you on Instagram if they have further questions? Awesome. No, that's fine. Yeah, and she's also tagged in the flyer on Instagram, so you can find her there. For those of you who aren't familiar with House of Medics, do make sure you're following us on socials. Sign up to our mailing list on our website, which is www.houseofmedics.org, because we run things like this every month. And we have lots of different opportunities and other ways to get involved and just enrich your career and learn different things. But otherwise, I hope it was useful. We'll be sending out a feedback form, and if you will be able to get you'll be able to get a certificate once you've filled out the feedback. So please fill out the feedback. It's always very short. It will only take a couple of minutes, and then we'll send you back a certificate for you to add to your portfolio, to say that you attended this webinar. But otherwise, thank you so much, Taylor. I'll let everyone go and have an amazing evening. Take care. Bye.